Okay, thank you everyone for your patience and thank you for joining us. Good afternoon and welcome to today's Block Grant 101 discussion. I'm Kanika Young. I'm the Senior Director of Health Policy and Advocacy at the Tennessee Justice Center. And I'm joined today by Gordon Bonneman, who is a staff attorney and the co-founder of TJC. Thank you for joining us on such short notice, but this is an urgent topic and we've been getting a lot of questions and there's a lot to unpack from the 220 plus page document that was released on January 8th. We'll try to answer as many questions as possible over the next 30 minutes. Please submit your questions in the Q&A box and we'll be monitoring that throughout the discussion. If we don't get to your question, don't worry. We're going to create a frequently asked question document with answers that we'll post online and also share in a link to an email to everyone who registered today. So let's jump right in, starting with a refresher of the timeline. Next slide. In May of 2019, our Tennessee General Assembly passed a bill that directed Governor Lee to submit a proposal to the federal government asking them to convert our state's current Medicaid program, which is known as TennCare, into a block grant. The bill specified that the governor needed to submit this proposal within 180 days. Next slide. So in the fall of 2019, September, thereabout, the legislator unveiled a block grant proposal, which had been crafted by our TennCare division behind closed doors. The release of the draft proposal started a mandatory 30-day public comment period. Over the course of that period, we did hear from lots of people who had concerns about the waiver, and a few of those concerns were addressed in the final version that Tennessee state officials submitted. They sent a revised version of the proposal to the federal government, CMS, which is Center for Medicare and Medicaid Services, and that public federal comment period started the day before Thanksgiving and it ended the day after Christmas. So it was really hard time to try to gather comments on this really groundbreaking proposal. The federal government was required to consider all of those public comments before it approved the proposal. So by the end of the public comment period, during that federal comment period, over 6,000 comments were submitted to CMS for consideration, and the overwhelming majority of those comments opposed the block grant. Next slide. So then finally in January of this year, January 8th, just days before the new administration took office or was about to take office, CMS officials approved a modified version of Tennessee's Medicaid block grant waiver. It was a very quick turnaround, and the Tennessee General Assembly voted last week to authorize the block grant. And that vote happened on January 15th, and I believe the governor signed it into law the next day. Next slide. So now that we've kind of set the timetable, let's look at what's actually in the approved waiver. And so to answer that question, I will turn it over to Gordon. Gordon.
Thank you, Kanika, and thanks everyone for joining us. Let me back up just for a second and talk about the traditional Medicaid funding formula, because without that, it's difficult to understand what this new arrangement is. Medicaid's been around for 55 years now, and throughout that period, in every state, including ours, the arrangement has been that for every dollar that the state spends for medical services for people enrolled in the Medicaid program, or here it would be called TennCare, the feds put up a certain percentage of that. And in our state, roughly speaking, every dollar that we spend is matched by $2 of federal money, and it's open-ended. There's no ceiling on that. What this block grant does is it imposes a cap over a 10-year period, and we are confined within that cap. Just quickly, we've had a waiver, and all a waiver is an agreement by the federal government to say, we're going to waive or exempt you from complying with certain requirements in the federal law. And we've had a waiver to run TennCare now for over 25 years, and it has had a cap a so-called budget neutrality cap that says we're not to spend more than a certain amount that would be what we could be expected to spend without the cap. And the reality has been that that cap has been very high, and it's never really been a constraint. It was never expected to be a constraint. Now they are calculating it on the basis of actual expenditures, and the first 5 years of the 10-year period, the cap is generous, and the state government will probably make money compared to what would have otherwise been the case. But in the out years, that all gets recalculated, and there is a real risk, depending upon who's in the White House and what the politics and the economic situation is at that point, that sometime after 5 years, probably 7 or 8 years from now, we could face huge dislocation in our state budget. So this is a go now, potentially pay later kind of deal. It's for a conservatively managed state, this is a risky deal. That's the way in short, that's the way the new financing works. No other state has sought this. No other state has been willing to put their budgets at risk with this kind of gamble.
I see. So one of the key features of the approved block grant waiver is this more restrictive prescription drug formulary. Gordon, can you talk about how the closed drug formulary compares to how prescription drugs are covered previously?
Yes, under federal law, states have to cover a wide range of drugs as part of meeting the needs of their Medicaid enrollees, and in return, the pharmaceutical manufacturers provide rebates to the states that basically discount at the end of the year what the states have paid to those manufacturers. The new arrangement says that the state no longer has to cover the broad range of drugs that are now required, but the manufacturers still have to pay the rebates. So there's been sort of a unilateral change in that agreement in ways that the pharmaceutical industry has already objected to. And I think from a consumer perspective, this gets to, I think, one of the few things that we know for certain. There's a lot that's speculative about this. As Kanika, as you mentioned, it's 222 pages long. It's very complex. I just came from a phone call moments ago with leading Medicaid experts, including former CMS administrators, and they just confirmed what we already knew based on our reading, which is that this contains a lot of risk for the state, but it's also up front going to be very costly to the federal government. It will be favorable in the early years. The big concern is that it creates an enormous incentive for the state to divert money out of Medicaid, federal Medicaid dollars, to anything, including, even although they disavow it, as in terms of what is legally possible and where the incentives are, the money can be diverted into highways or any other state expenditures. So given the state's history with TennCare, I think anyone who's concerned about whether this will provide for the care of consumers should be concerned, because the incentives are very strong to divert, to save money. And the one place we know they can and will do that is on formulary. I think as a consumer advocate, I have reservations about some of the drug pricing abuses that we've seen in recent years. But the reality is that, as is evidenced by the successful development of vaccines, the pharmaceutical industry provides products that save lives and actually prevent downstream costs. So cutting back on formulary really has pretty grave concerns for patient welfare. And the incentives are to do that with more regard to being able to use the money in other parts of the state budget than on ensuring patient safety.
The waiver, when it comes to the closed drug formulary, mentions an exceptions process for people who need access to drugs that may not be on the list that TennCare approves. Do you take any comfort in that exceptions process being a safeguard for consumers?
Well, I think, Kanika, that that's sort of like the whole thing. The whole thing is pig in a poke. We don't know what's going to happen in out years in terms of the state budget and what that may force in terms of cuts in federal funding for Medicaid. But we also don't know what that exceptions process will be. For that to work, I mean, first, that's an imposition on providers. Busy providers, doctors, prescribers are going to have to take time to go make the case that this patient should get a drug that the state and its managed care contractors don't have to provide and don't want to provide. And what we know from the experience of managed care is a lot of that, as a judge said in one of our cases in the past, there's a lot of delay, deny, and that wears down doctors and their staffs who are very busy, that they have to go and argue with an insurance company about why an exception should be made. So that in itself, even if it has all the exceptions it should be, there is attrition with patients not getting things because the doctors don't know what magic words they have to use to make the exception process work. The other thing we know is that TennCare has a poor track record when it comes to administrating complex processes. The most obvious being eligibility, where I'm not telling you anything you don't know, Kanika, because you've written about this, but where we have seen, for example, 220,000 children losing coverage in the redetermination process, not because they were ineligible, but because of paperwork issues. So you see in the rhetoric around the waiver assurances, though, we're not going to cut benefits, we're not going to cut eligibility. That's not, they're not foreclosed from doing that. The TennCare program has shown the ability to cut costs, save money without changing eligibility formally, just by paperwork burdens. And so the same thing holds for the exceptions process with the formulary. I think it is inevitable that there will be people, at least at the margins, if not many more, who will not get the drugs they need and will be harmed as a result, just because they or their doctors or the TennCare contractors can't make the complexity of the exceptions process work.
I think one point you just made about paperwork burden goes to one of the questions that we have gotten frequently from people who've heard from representatives and centers who said this block grant would not be a cut to our Medicaid program. There'll be no reductions in people served, no reduction in benefits, provider rates, or quality access to care. And there is a requirement that the state keep TennCare eligibility and benefits at or above end of 2020 levels. But as you stated, that doesn't mean that the program is safe from cuts. Do you want to elaborate any on how the state could effectively reduce access to services for enrollees without changing eligibility or benefits?
Well, they can tell the managed care contractors to be tougher on determining what's medically necessary care. They can make the exceptions process for the formulary more difficult for everyone to navigate. As I said, they can make the application process and the annual redetermination process onerous. The federal law requires that they redetermine the eligibility of everyone every year. And again, the most vivid example is with children, because most children remain eligible from year to year. But not only do they cut off 220,000 children, but they cut off 300,000 people altogether, just on the grounds that they failed to complete the paperwork. And we have a lawsuit pending in federal court right now, where the people we represent had documented evidence that they had sent back the paperwork and they were cut off for not sending it back. They had fax receipts, they had postal receipts, and TennCare swore up and down, you didn't send back the paperwork, so therefore you no longer qualify. There are computer issues. There's just any number of ways that they can skin the cat. And I'm not suggesting that somebody sits in a darkened room somewhere and comes up with plans for doing that, but the financial incentives are very strong. And when the financial incentives are that strong, people focus on the things where the incentives lead them, and they tend to give short shrift to maybe some of the downsides, like perhaps people are being cut off who shouldn't be cut off. Perhaps we need to be more careful about how we run the exceptions process.
And in terms of what we can expect after 5 years when the cap is rebased, what are the risks to the state once that process happens?
Well, it's a 10-year program, and the cap is calculated over 10 years. So really for the next 5 years, there's little risk to the state budget. But the problem is that we could have a day of reckoning, and a lot of this will depend on who's in control at the federal level in 5 years. What's the political climate? What's the economic situation? If the climate at that point is we've got to do something about the federal deficit, and we're hostile to, if it's an administration that is hostile to Medicaid, like the administration just ending, we could see where they come back and they say, it's really very much like entering into a mortgage or a long-term loan arrangement where, the first 5 years are fine, but there could be a huge balloon payment at the end, which could leave our budget in dire straits. We just don't know. I mean, no one knows. There's no way to know. And that's what's risky about it.
Right. And also in terms of that uncertainty and risk, there's also the issue of the flexibilities that the state has been granted under this waiver, where they can make changes to the program without prior federal approval. Why should people be concerned about that flexibility?
Well, let me give you an example to go back to the problem of people who lost their coverage during redetermination. During the last couple of years of the Obama administration, when TennCare was struggling to institute a new computer system, they kept wanting to start the redetermination process, and the feds kept saying, you don't have a reliable process, you need to go slow, here are problems. If you don't fix these problems first, then you're going to inadvertently cut off a bunch of people who are eligible. When the Trump administration took office, they no longer applied that level of oversight, and the result was that 220,000 children, almost all of whom were eligible, lost their coverage, just as by virtue of the relaxation of that federal oversight. So that's very concerning.
Before we leave this slide, I just want to ask one question that we received from the audience, which is, can you refresh people's memory about what the stated rationale has been from the state about pursuing the block grant waiver, and what would you say is the unstated rationale for it?
Well, the stated rationale is we want the flexibility to be creative, and we can run the program more efficiently without all this federal regulation and oversight. And because we run an efficient program, we should be allowed to keep part of the savings and use those savings for non-Medicaid purposes that will promote health. The so-called social determinants of health. That's the rationale. And by the way, they've also mentioned that maybe they would expand coverage, for example, postpartum coverage for new mothers. There are modest changes like that they've talked about, and they've said we can make hundreds of millions of dollars in savings by running this efficiently. I would say two things to that. First, if you look at us compared to other states, we already have one of the most stringently run you might call it efficient, but certainly however you characterize it, our expenditures are way at the bottom compared to all the other states. So our opportunities to get rid of fat are not great because there really isn't any fat in the program. So the idea that we're going to get hundreds of millions from running more efficiently, no, I'm afraid where we'll get those savings is by denying care and starting with the formulary changes, the access to prescription drugs. And I would just add that that's really concerning because, you know, Willie Sutton, the bank robber, when asked why he robbed banks, said, well, that's where they keep the money. And the Willie Sutton principle applies to Medicaid savings. If you're going to save money, you're going to go where the expenditures are, and that's chronically ill people with high medical needs and high medical expenses. Because, you know, for example, if you say we're no longer going to cover this expensive cancer drug, and I would just point out that Cancer Society, American Cancer Society, all the major patient advocacy groups have opposed the block grant for this very reason, because it puts their constituents at risk. Because they understand if you say we're no longer going to cover that expensive cancer drug in our formulary, that does no harm to anybody that's walking around well without a cancer diagnosis. It only hurts the people who have cancer and desperately need that drug. You can't save money on expensive care without taking it away from the people who are using it. So the concern that the pitch that we're going to save money and we're going to be able to use this elsewhere for good things to promote health, I would say first, we already have a very restrictive program. There's no way to cut without cutting those who need it the most if you're going to really save money. I would say that the incentives are to spend it in other parts of the budget. This would not be the first time that we've seen TennCare divert federal money into other parts of the budget. That happened during the Great Recession when stimulus monies that were explicitly prohibited from being put into the rainy day fund were put into the rainy day fund rather than being used to meet the growing needs of people. And if the concern really is to expand coverage, then expand Medicaid by implementing the Insure Tennessee plan, which, as opposed to the speculative prospect under the waiver of gaining a few hundreds of millions of dollars, as it's touted, we know that former Governor Haslam's Insure Tennessee plan would be generating $1.4 billion a year, not as a matter of speculation, but as a matter of federal law. And it would be covering 300,000 working Tennesseans who are now without coverage and who are in the middle of a pandemic that is taking lives every single day. So, excuse my cynicism, but if you look at the things that are said in favor of this and you just take them at face value, you would say, well, if you're serious about that, then you should expand Medicaid. You shouldn't be putting the budget at risk in future years and putting at risk the health of Tennesseans.
Yeah, I'll also note that if the state wanted to cover additional people, expanding Medicaid would be more fiscally wise than doing it under whatever savings that they could get from the block grant, simply because of the matching rate. If they expanded Medicaid under the Affordable Care Act, the federal government would pay 90% of that cost, versus in this situation, the block grant has that cap funding. And so the state would have to be spending 35% of that cost in order to cover those additional people. But we'll move on to the next slide in the interest of time and talk about just briefly the key differences between the proposal and what we commented on last year. Gordon, if you could just speak to some of those key provisions.
Well, it's a 10-year waiver rather than 3 years, and that, by the way, is not consistent with federal law. It's one of a number of procedural things that they did here. They cut off the federal comment period that was to open for the new for the renewal of the existing block grant. So there are a number of procedural things they've done to shortcut transparency and public input. They have, to protect this, The outgoing administration sent a letter at the beginning of the month saying that any rescission of a block grant, I'm sorry, of a waiver generally, this is the only block grant, no other state has sought one, but any waiver that is negotiated with the federal government, in order to rescind it, there is an elaborate and time-consuming appeal process that the state can use to basically keep it in place for perhaps a year to year and a half. They've done that to try to tie the hands of the incoming Biden administration. That whether that is lawful is very much an open question. I would just say there are a number of legal questions about the whole thing, but certainly the attempt has been made to try to prevent or at least delay the Biden administration from unwinding this. And that's why we saw the unseemly process last week where the legislature voted this through without really understanding the terms.
So in the minute that we have left before Gordon has to run, if we could go to the next slide and just, we'll actually advance one more and one more. So what's next, Gordon, in your mind in terms of where we go from here now that the block grant has been approved?
Well, I think it's important to let people know this is not the great deal that's been advertised. I worry that this takes the pressure off of Medicaid expansion. I think that's certainly part of the problem. Part of the purpose was to change the subject because the Insure Tennessee plan has remained popular. And given the pandemic, given the continued crisis in rural hospitals, there's a lot of pressure on the legislature and on the governor to do something about that. And this is an effort to change the subject. And so I think it's important for people to let public officials and the public at large know this is not the answer. This is a distraction, and it's a potentially dangerous one for Medicaid patients, TennCare patients right now in the short term, and potentially for the state budget in the long term. So that would be my thought about sort of job one right now.
Thank you so much, Gordon. I know you have another call to get to, so if you need to hop off, that's fine.
Thank you so much.
Sure, that's very helpful. So we have a number of questions that were submitted that we couldn't get to. 30 minutes was not enough time, I guess, to cover this topic, but we will answer your questions. If you've already submitted them in the chat or the Q&A box, we will try to answer those questions as best we can. If you think of other questions, feel free to email me at kyoung@tnjustice.org. Again, that's kyoung@tnjustice.org, and we will incorporate your questions and answers into an FAQ document that we'll post shortly. So